Understanding how to read the results of blood pressure measurements is an important task. This video will explain this topic. Sedentary behavior and a high caloric diet is a prescription for poor health, leading to overweight conditions. As obesity rates continue to climb, hypertension and related disease conditions continue to be seen in individuals beginning earlier in life at younger and younger ages. One condition that is common within many individuals following this lifestyle is high blood pressure or hypertension. Blood pressure readings are measured in millimeters of mercury, with two numbers presented as a result. These values are termed systolic and diastolic and represent the pressure exerted upon the arterial walls. The systolic value represents the blood pressure exerted on the arterial walls when the heart is beating, that is when it is actively pumping blood. The diastolic value represents the pressure when the heart is at rest in between beats. The result of the blood pressure reading, represented by these two values, helps identify if an individual's blood pressure is normal, low, prehypertensive, or hypertensive. When reviewing the chart or discussing someone's blood pressure, the first number given is the systolic, then the diastolic is given. An example could be 119/78. What values are considered healthy or normal? For systolic, a value that falls from 90 to 119 is considered a normal systolic value. Any value from 60 to 79 would be considered a normal value for diastolic. The above reading of 119/78 is considered normal. A reading below the low-end threshold of either of these two values would indicate a low blood pressure, otherwise known as hypotension. An example reading of 88/58 would indicate low blood pressure. Prehypertension is a reading by either value that exceeds the upper threshold of normal values, but not so high that hypertension is seen. The range for prehypertension is 120 through 139 for systolic or 80 through 89 for diastolic. A reading of 135/84 would indicate that the patient is currently in a prehypertension state. Hypertension occurs when either value exceeds the prehypertension upper limits, a value of 140 or higher for systolic, or a value of 90 or higher for diastolic. Hypertension is sometimes broken out into stage 1 and stage 2, as well as hypertensive crisis. Stage 1 would be 140 to 159 for systolic, or 90 to 99 for diastolic. Stage 2 would be 160 or higher, or 100 or higher. Values 180 or higher or 110 or higher could indicate a hypertensive crisis. When determining results, keep the following in mind. A single reading does not indicate a chronic condition. It indicates a current status. Multiple consistent measurements over a period of time should occur prior to any diagnosis being made. Even though the values of 120/80 are the start of the prehypertension values, these values are conventionally considered normal. If a hypertensive crisis is occurring, the individual should go to the hospital. Correct interpretation of the measurements is vital. Just knowing the ranges is not enough. Only one of the two values needs to be elevated for the patient's current status to change. You always want to take the highest value from both values measured to understand why a patient was diagnosed at a particular level. Let's go through a few examples. What would a blood pressure of 116/77 indicate? That would indicate a normal or healthy blood pressure, as both values are within the normal range. What about 136/84? Here, both values indicate prehypertension. Values of 142/79. A value of 142 for systolic indicates hypertension, while a diastolic value of 79 represents normal. Remember, always use the value that indicates the highest pressure. This would be considered hypertension based upon the 142 for systolic. Lastly, a value of 136/96. A systolic value of 136 indicates prehypertension, but the 96 for diastolic points to hypertension, so this would be considered hypertension. The 4 questions that follow this video will further test you on your understanding of this topic.